So hi everyone, welcome to our panel about resilience beyond the hospital. First of all, thank you for joining us on a Sunday, I guess morning in my location, but on a Sunday. So today we're going to talk about like a really important topic, both in life and also in medicine, which is the concept of resilience. So resilience, you probably heard this term from different contexts, but in general, it kind of refers to our ability to kind of adapt and recover from challenges, stress, or adversity. And in both medicine and personal life, resilience is very vital as it enables ourselves to cope with difficulties and maintain our well-being. And in medicine, resilience helps patients to face serious diagnoses, chronic illnesses, or recovery from surgery by fostering that mindset that promotes healing and adaptation. And as healthcare providers, they also rely on resilience to manage the emotional toll of their work and to maintain compassionate care despite the high pressure involved in their work. And in personal life, resilience allows individuals to navigate their loss, failure, and unexpected changes with strength and flexibility. So building resilience can improve mental health, relationships, and overall quality of life by providing a framework for overcoming obstacles and going through hardship. So today we have an awesome group of panelists that will be sharing with us their story of resilience. And there will be a wide range of stories of resilience that we'll be able to hear both in the medical context, in academia, and also or in their life in general. So after that, we will open the floor for questions and discussions. And hopefully you'll get to enjoy this session. That's kind of like the overview of what today's panel will look like. So without further ado, I'm going to introduce our first speaker, Dr. Saha. So Dr. Saha is an academic foundation year doctor in Northeast London. And in medical school, he is very accomplished. He has 11 publications, over 50 international presentations, 19 academic prizes, and also 3-book chapter authorship, and also has an intercalated Bachelor of Science in Genomics. And he currently is pursuing a master's in musculoskeletal sciences at the University of Oxford and is a junior clinical research fellow in complex spine surgery. And he has worked on international collaborative research in orthopedic surgery with Johns Hopkins University, Harvard University, Yale University, and Leiden University. And in the future, he is passionate about pursuing academic orthopedic surgery and global surgery. And the next speaker that we have is Dr. Putra. He is the president of Incision Indonesia, focusing on enhancing child health and surgical access in the country. So she works to improve healthcare infrastructure, training medical professionals, and increasing awareness of pediatric surgical needs. And her commitment for these is hoping to ensure that children receive timely and effective surgical care and addressing a critical gap in the healthcare system. And next we have Dr. Shukla, who is a medical doctor from India and an emerging surgeon scientist in the United States. And he is a National Institute of Health T32 grant awardee and research resident in the Department of Surgery at the University of Pittsburgh. And Dr. Shukla specializes in multi-organ failure and operative cellular stress and has a strong emphasis on improving surgical outcomes for diabetic patients. And Dr. Shukla's expertise spans clinical research and industry-sponsored trials, and her pioneering work includes doing first ever FDA-approved stem cell-derived islet cell transplantation for type 1 diabetes with her mentor at the University of Chicago. And she has held prestigious positions such as clinical scholar at Harvard Medical School and a comprehensive transplant center scholar at Northwestern University. And beyond these clinical contributions, she is a passionate advocate for surgical access and equity, and is the current chair of the Incision's National Working Group in China and the General Assembly co-chair for Gender Equity Initiative in Global Surgery. Lastly, we have Santiago Rico, who is a medical student at Columbia and also a UNESCO Center for Peace Youth Ambassador. He leads a UNESCO Center for Peace summer camp each year in Washington and maintains a strong foundation in encouraging youth activism and political engagement. And his unique perspective as a youth ambassador himself from a young age has prepared him well for the challenges of the future and also where he develops a strong spirit of resilience. So we have a really good panel of really good panelists today, and I'm going to ask the panelists to start sharing the speech they have prepared for us today.
Excellent. Should I go first?
Sure.
Excellent. Thank you, Helen, for that introduction. Yeah, so I'm Priyanshu. I work here in London as a PGY1 doctor. I would like to focus my topic on sort of the resilience that I experienced slash demonstrated during medical school, especially in the terms of extracurriculars, apart from the basic medical curriculum that we have set out. I think medical school itself, as it is very difficult. The syllabus can be difficult, and this is not just country to country, but this is worldwide. Getting through medical school is hard as it is, and for many medical students, that would be the greatest achievement. But I've because of my background, I'm not from the UK. I was born in South Korea, but I'm of Indian heritage. I grew up in lots of places around the world. I've never really had the chance of creating roots anywhere. So wherever I've moved, I've had to think about the other opportunities on how to stand out. And in medical school, that was through a bit of an academic path. In the beginning, I had no idea how to go about it. I had no guiding person or someone to follow or mentor or anything. No one told me how to get into academia, how to pursue research and presentations and even winning prizes and grants and scholarships for it. I think it was a bit of a challenging scenario in the beginning of medical school because I didn't know really what sort of specialty I want to do or anything like that. So finding even a research topic or a research mentor was a challenge of its own. I think in second year when we had an assignment in medical school, we were just randomly assigned to different doctors and surgeons around the hospital for a lit review or systematic review that we wrote. And I didn't really have a particular interest in that topic at all, and I just basically did the bare minimum to get through it. And then over after second year, I learned a bit more. I started spreading out and like thinking about the specialties I want to do. And I reached out to different researchers and people running clinical trials and asking, oh, can I help in any way? Can I do this? Can I do that? And it was quite challenging because out of the hundreds of emails I sent, maybe I got 5 or 10 emails, and not a lot of them even were positive. So I gained experience in different things, cardiology, some genetics, hence why I took the integrated genetics degree later, plastic surgery, diabetes and endocrinology and everything. And that helped me develop an armamentarium of research skills, like how to do a lit review, how to analyze data, how to b- go about writing an abstract or a paper and presenting that paper at international conferences. Those experiences that I gained was completely done by myself. Often the education I got was through YouTube, or I had to ask senior academic clinicians or anything. Nothing was handed to me, and I think that is a big part of medicine, especially people that don't come from medical backgrounds. There's no one to tell you how to do it. You sort of have to pick your own battles and then go through with it step by step. You're going to make mistakes on the way, and eventually those mistakes come help you because when you correct your own mistakes, you gain confidence, and when you'll be facing that scenario again, you'll have an opinion about it, and that's invaluable because many people that are don't make those mistakes and are given things, they're actually unaware about well, how to lead on a project, how to write a thing, or have any opinion about a academic matter. Eventually, throughout the medical years in medical school, I sort of circled back to the same topics that I actually did in my second year, and that was on orthopedic spine surgery. And I sort of asked the orthopedic spine surgeons at my medical school whether they would like to have, if I can do more research with them. And eventually, they gave me more responsibility, more academic work to do, and that sort of snowballed at one opportunity from one opportunity to another, and it just kept getting bigger and bigger and bigger, and you kind of fall into a flow where you start publishing and then you start doing bigger presentations with wider audiences and bigger, more academic scenarios like international conferences. So resilience is only demonstrated in those who seek it, and if it's very easy to sit back and just let the world sort of take over and the world moves on if you don't sort of uh, create your own path, you have to be able to make those decisions at any stage, not at an early stage, mid stage, or a late stage. You need at some point you need to be able to just keep pushing towards what you want to achieve. And right now, because of those self-driven efforts that I put during medical school, in my last year of medical school, I did two electives at Johns Hopkins. And they were very inviting about whether if I want to apply for residency there. And that's something that I'm considering at this point. And because of that, that also is now allowing me to do a master's in musculoskeletal sciences or orthopedic sciences, again, with individuals that have had similar sort of self-motivations and backgrounds and people that are trying to achieve the same things. So I'm right now quite set on pursuing orthopedic surgery, but also global surgery at some point until I sort of develop an expertise in that field because global surgery is quite a complicated topic, and being around individuals like that in that space sort of motivates me to also keep doing something like that. That's it for me.
Thank you for sharing that. That was very inspiring. Does Oh, I guess we'll leave question at the end. So if you have any questions for Dr. Saha, we'll have a question period after um, every panelist has shared their story. So next we have Dr. Um, Putra. Am I pronouncing it correctly?
Yes, yes, that's
Okay, awesome. Thank you.
yeah. Thank you, Helen. Oh, sorry. I will also share my experience as a medical doctor and also as an internship doctor when we faces the COVID-19 situations, and it related with the resilience, I guess. So basically, I was graduated at 2021. It was the high cases of COVID-19, and I was working at the emergency department after my graduation quickly due to the COVID-19 situation that really needed a doctor to practice and help the hospital uh, because of the situations that a lot of patient die and has a minimalized ventilator and etc. To be honest, it was very stressful because I was graduated and quickly starting my internship and having a lot of patient, like 80% of my patient was a COVID. And I was worried about my condition due to the COVID-19 situations. But after I work at emergency department, have a great team with others, my friends are having an internship. We are faces that the pandemic was very impactful for our life because it was unexpected first, and we need to resilience with the conditions. And we have been working a lot because of there is a lot of my friends having a COVID, and we need to cover up of their works. To be honest, it was very stressful because I was never get a COVID. So I'm always back up my friends when I have an internship at the regional hospital. A lot of cases that was very stressful because my patient was coming up to the emergency department having a short of breathness and then die like quickly, 10 until 30 minutes. But after that, I learned a lot how to manage a patient and how to um, impress the patient after having emergency situation and how to become calming when we faces that the chaotic situations during the pandemic, because Indonesia have been limited for hospital, especially in rural area, and some of patient die when we send a patient from the public health center um, to the regional hospital that we have. And but after that, we have been quickly having a clinical trials in Indonesia to have a COVID-19 immunization or vaccination that has been having a research about phase 3 of the COVID-19 vaccine from Sinovac, a collaboration with China. And we were having a good cases after that, like the cases was slow after the have a good vaccination rate and awareness of the patient with the diseases. But the problem is not all of the people in Indonesia the vaccine um, can get all of the vaccine because of the geographical situation that Indonesia is a archipelago countries. We have like 17,000 island across of our countries, and we have a problem with how to reach people at the rural areas across of Indonesia. So a lot of problems that we face is due to the vaccination rate, and also how to change the hooks and how to educate all of the Indonesian people that the vaccination is really important. And because of our government have like very tight and also very concerned about the vaccination, and Indonesia have a good vaccination rate, and it was really good because we have more than like we have a lot of vaccine because of the advocacy that used by our Ministry of Health and our president was very good. And that's why Indonesia is having a good rate of safe vaccination of COVID-19 in the world. So after I finished my internship, my professor was invite me to join the clinical research projects about COVID-19 vaccine, because Indonesia have problems with limited vaccine, but we need to cover up of the vaccination rate in Indonesia. So we have a clinical trial that a half dose of vaccine COVID-19 is the same results with the full dose, and it was the same, and the result was the same. So we have a like policy that we also accepted a half dose of COVID-19 vaccine for our for our people. So it also helped us to quickly going out from the pandemic situations. So I think that I joined the clinical research team was very insightful, and my experience how to be resilient as a medical doctor, not working at the emergency department, but having also a research skill and research experience to resilience with the pandemic situations. And I think it's really helpful for us, like me as a fresh graduated, join the clinical trial internationally and collaborations. I think it's like a very good experience for me due to the COVID-19 situations, and having an experience with the patient with the critical ill at the emergency department is very helpful for me now as a doctor working at the emergency department to quickly managing the patient, because Indonesia having problems with the healthcare system until now. So I think that's my experience. Thank you.
Thank you for sharing your story and perspective from your work in during COVID, and also your work at Emerge in Indonesia. And again, if anyone has questions for Dr. Putra, we'll save it at the end for the question and answer period. And next we have Dr. Shakla, who will be sharing her story with us. Is Dr. Shakla here?
That would be me.
Okay, hi.
Hi. Hi, everyone. Thank you for having me on this panel. And I really appreciate that you guys are actually trying to talk about resilience and struggles on a platform like Incision, which has such a wide reach. I would say like resilience in my journey has been like a constant companion, like throughout, as I try to navigate my career in surgery and academia as an international physician abroad here in the US, because I would say like at each step I've faced some sort of resilience, and it does not necessarily have to be like the villain of the story, because if you're like gaining the right lessons after your experience in resilience, it can really frame you, and it can build your foundation very strong in a career like academia. It really teaches you that if the doors are open, like how do you make a new pathway? It can like definitely build your fundamentals very strong, because few years from now, after being a trainee, you're looking at a career that involves you to be, for example, if you want to be a scientist, it involves you to be a principal investigator of some study. And that's a journey that you start alone. You started from scratch, and for a long time, you stay the lead of such a project. And I would say, like, to begin with, like, I've seen resilience in like each way that I've tried to build my profile, for example. Because like back home where I come from, nobody thinks about doing anything on side of medical school. Everyone's focused on their profs and their results and getting into a postgrad. In fact, like a lot of times we don't know anything about research. We don't know about grants. We don't know about any NGOs like Incision itself. And I'm not gonna lie, like even to join Incision, few years ago, like 3-4 years ago, I was trying really hard to connect with the chairs of incision, for example, and I would like not get a reply for months. And that kind of like taught me that and that was like, that had nothing to do with the chair itself, just to be clear. It definitely was about whatever was going on with the EB and COVID and everyone's busy. So it definitely teaches you, if you don't have a guide, you can build something on your own. Like you can, like, for example, in my case, I figured out that at the time China had no national working group. So instead of me trying to join a team that already was existing, I tried to build an NWG from scratch. So I was the inaugural chair of Incision China that way. And a lot of people back in China were supporting me with that journey. But to begin with, to join Incision, I faced some resilience. But what it ended up doing was giving me an idea about how do you start an association from scratch, a national working group from scratch. How do you reach out to people? How do you work on application? What is the stuff that goes into an application and your plans? So in a way, I would say, like, if I hadn't seen some resilience in my journey, like I wouldn't be achieving more stuff than I predicted. Like I assumed in start itself that I can mark XYZ things by this time in my journey. It just definitely gives you more skills if you're facing some hurdles on the way, be it research, be it your electives, be it the patient encounters. Because I would also say that, like, being a woman in healthcare space, a lot of times even your patients can start doubting you. They would like ask for a certain physician of certain age, of certain gender. So these types of things exist throughout the path. So either you learn to fight it or you just can't handle it then. So that I have definitely faced a lot of resilience, and I can speak for a lot of my colleagues who had shared similar experiences. But yeah, I welcome any questions if anyone has. That definitely is like my 2 cents on my experience with resilience. Thank you.
Thank you for sharing. That was very insightful. And if there's like more questions, there will be that question answer period. And that kind of reaches, let us reach to our final panelists. Santiago Rico, you now have the floor. Are you here?
Yes, I'm here. Thank you. Sorry again, I cannot turn my camera at the moment. I'm currently driving, so I'm really sorry for this. Regarding resilience through as a medical student and also as a youth ambassador at UNESCO Center for Peace, has been the villain and the hero of my story, because I have been working with UNESCO Center for Peace since 2017, one year before I entered med school. And I first started struggling with adults that they didn't take me seriously in all my activities. So I went to United Nations events. I went to talk and coordinate with schools to organize delegations so they can travel to the UNESCO Center for Peace summer camp. They didn't take me seriously enough in order to create partnerships and things like that, even though I had the full support of my organization, the full support of the director of the organization. But even though my age was a problem back then, I went through, I took some lessons in order to create a more effective communication, change the way I speak with people, change the way I express my ideas, try to look a little bit more mature in the way I lead my teams in order to create a little bit more of trust among these people that they didn't took me seriously exactly just for my age. Sorry. But a few years later, I encountered with something else that I didn't expect. Once I entered university and I entered med school, I asked for several academic permissions in order to assist to United Nations conferences like the one on 2019 that was of universal health coverage in New York. I offered the university to represent the university itself in these events in order to bring on the name of my university in such an event. And I didn't get the support I expected from them. I just got like a lease from my academic duties in order to continue traveling for only 3 days, because that was the whole permission I got. um, but that was because, and I think that I don't have certainty about that. I think it was because they didn't believe that, again, such a young person can could make those things happen in reality. Like a 19-year-old guy just going to United Nations as a youth ambassador, representing a university, representing an NGO accredited to ECOSOC and things like that. Just being 19 years old, no title, no degree, no everything, just a few years experience in model of United Nations, few years experience on many other activities of international cooperation, and a medical student involved in international cooperation issues, in diplomacy, in law, in many things that, as one of the panelists was saying, people in med schools, they are really focused on the grades, on the examination results, on the post degrees, on the residency, and they forget about the NGOs, they forget about the international cooperation issues, they forget about the things that we make actually matter, even though it's not 100% related to med school, because even though we share a passion for medicine, we have other passions, we have other dreams, we have other ways to read what is to be a doctor in medicine. So once I started like growing my career, growing in med school, following and trying to look for a balance between both lives, because I was like a comparison that somebody told me once. He said to me, "You're like Hannah Montana. You are med school student, and also you work like a diplomat as a youth ambassador by day and sometimes by night and things like that." And I was wondering at what point I will be able to join both lives that I'm looking at. For example, yesterday I was just finishing my shift at the hospital, and today I'm going to the COP16, just looking at that. And I struggle a lot in order to look for that balance until I understand that I don't have to give up one life or the other. I can join both of them in in a way that I didn't expect it came to me. That is, for example, public health or international public health advocates, and that area where I can join both lives. And I hope for next year, once I finish my degree, I can start following and pursuing the dream that I have been working really hard in order to achieve. So, in summary, that's my story.
Thanks, Santiago, for sharing your story with us. So, and thanks for all the panelists that have shared very very insightful stories about what their experience with resilience is, and how they have been challenging themselves in both in the medical setting and also in their pursuit in academia. So now I'm going to open the floor for the audience to invite questions. Whoever wants to ask any of the panelists about any of the experiences that they shared or any other questions that they have. Now, I'm going to first ask whoever is in the audience to ask any questions and give it about like maybe 5 minutes or so. And if not, then I also have like a couple of questions prepared for us to discuss as a group.
I do have a question, if I may.
Sure, go ahead.
Yeah, it's for Dr. Priyanshu. So I'm wondering, with everything you've done so far, have you faced burnout? And if yes, then how do you prevent it? Or do you have any tips for anyone?
That's a great question, and I think I don't have a perfect answer for that, but I think burnout is inevitable in whatever academia that you're pursuing, maybe medical school, maybe research, maybe anything. I think I'm very lucky to live in a place like London for the last 6 years, but more importantly than the place, it's the people that's around you, and having a solid network of friends, supportive friends, people that understand you, people that know how to pull you out of the very serious stuff and keep your life a little bit lighter and easy is really important to manage burnout. I think during the COVID pandemic time, I was like halfway through medical school at that time. Yeah, I was in complete burnout at that time. It, no one was seeing each other. I'm quite social as a person, so I need that. So I was not getting that social interactions. I was being expected to study, attend placement, but not interact with anyone during like my clinical rotations or anything. I think understanding how to predict or understanding what causes you to burn out and being cautious and taking sort of the necessary action beforehand to make sure you don't burn out is really important. In my context, having a strong social circle, engaging in like personal reading, um, playing my instruments. I play guitar recreationally and exploring and experiencing new things. Having like balancing that was really important. Being able to say no to things is also really important. There will be times where like your principal investigator or sort of the head of the lab or your supervisor will ask you to like, oh, you need to submit these many abstracts, or I need a new draft of this manuscript by then, or just generally like during exams time, when you see that you have 5 or 10 topics to cover in the next 1 week, when it physically does not seem possible, give yourself an afternoon, a day, or a week off, and just know that to achieve something and do it in a good quality, you need to be a bit more mentally intact. If you're burnt out, you're not going to be able to produce the quality that you want to see or other people want to see. Yeah, just creating healthier habits. And this is something that I've been developing over the last 6 years, but I think I'm still a victim of burnout. And I think since starting my job, I finally got a week this week where I just got to unwind and really reflect on what I've been learning and doing and practicing as a doctor and sort of those aspects and being able to detach from that and go refresh in your mind. And when you go back into that space, you'll be aware of more aware of the things around you. Sorry, it seems a little bit if that was a little unclear. Yeah.
Yes, that was a great answer. Thank you. I do believe that each person has their own way of dealing with burnout, but that's a good strategy, I would say, especially the saying no. I know it does hurt sometimes when you get an opportunity that really means a lot to you, but you have to say no for your own mental health and physical health. So I appreciate your answer. Thank you.
Right.
Oh, I think Dr. Torres also has a question.
I'll actually I wanted to add a little bit on what Miriam just mentioned about like knowing when to say no, right? I think on a slightly like talking about saying no, I think on a similar on the opposite side of the spectrum, then we also have being told no. And I'm pretty sure that everybody here has been told no, if not once, multiple times, or else we wouldn't be here, right? So I actually wanted to direct this question to Dr. Santiago, because you mentioned being told no, especially as a youth advocate. Your age has been like, put into question many times. I can relate to that as well. Usually, as a young person, you're not taken seriously, and sometimes it's because maybe some people find you a threat. I don't know, like and you've really learned how to adapt to that by adapting like how you express yourself, and knowing that. But I wanted to um, get a little bit more details on that, because like I'm kind of curious, like do you have like any specific examples of like how you learned to express something, or ask for something that you've noticed like gets you further, and how have you um, what's the word, like how have you managed being told no so many times in the meantime, and like changing your strategy, but at the same time not worrying, making sure you don't get depressed by being told no, so yeah, I just would like a few more thoughts on that.
I will turn on my camera now that I'm currently parking now. Well, I understand it's really frustrating to encounter those situations wherever you don't get the approval of the people you're willing to get that support. It's really, really, really struggling. It's really frustrating. For example, I had an advisor in my first year as med school, and he said, "But why are you doing this? You're a med student. You're not an international relationship student. So 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 why you're doing this?" And I said, "This is my passion." I'm slowly starting to let him understand why I'm doing this, why it's for me important to achieve these participations, why it's important for me. And I think that the key component of starting to get a little bit more of authorizations, a little bit more of respect from the the more adult people that I encounter with was having one person that believed in you. It's the starting point for you to start developing a network of people that believe in you. So, for example, all of you that are here connected, you and all the people that we have as a public, and all the people that will watch the recording, they will start believing in us. And doing that, so they will start believing in themselves in order to get that encouragement they need to take that first step too, and looking for someone to believe in them, for someone to believe in each one of us in order to start growing. Also, I complemented a lot of things, trying to first of all, I try to improve my speech in order to try to look a little bit more serious when I'm speaking, trying to change the words uh, to a little bit more academic language, even though I'm not saying anything, but I'm using fancy words, something like that, in order to let them know I'm talking serious. I'm taking every single thing I was doing as it was a meeting with the president. If I was going for, I once got an invitation as a guest speaker at a Model of Your Nation in a really small town here in Colombia. And I presented myself not to my teachers, not to my advisor. I presented myself directly with the dean of the faculty of medicine of my university. I took out an appointment with him. I made a presentation. This is myself. This is my life project. This is the experience I have now. This is what I'm aiming to. And I'm looking for a permission so I can be a guest speaker in the Model of the Nation with this school in Pereira, for example. And once they start looking at me and, okay, this guy is talking seriously right now that he is going, no matter what we say to him. So he better get our support rather than not getting our support. So I think that would be my answer to your question on how we can improve being young leaders trying to move forward in a world that the main obstacle is our age.
I have a follow-up question, or it's just inquiry. Well, I myself during high school was very involved in Model United Nations, and I did around 15, 20 national and international conferences around the world. So I was very passionate about that. And in an alternate life, I imagine that I would have pursued international relations or politics, and um, yeah, like basically really, really wanted to work for the UN, WHO, sort of the big world organizations. I just never knew that was even a possibility because in my heart that I wanted to be a doctor. I was like, oh, I need to dedicate all my time and energy now. I think at age 17 or just starting 18, just the last year of high school, I basically abandoned all that. All those years of hard work, I just was like, that's enough. Put down the pedal and put down the book and just pick up my medical studies, and that's it. So it's really inspiring that to see that you were able to continue that parallel to medical school and being able to do that. And one day maybe I can get back into that space, but I don't know exactly how to. So maybe you and I can have a conversation later about how to pursue that.
Of course, of course, of course. Please contact me. You can still join UNESCO. You can join UNESCO Center for Peace. We are organizing young students leader for the international cooperation team. We are not looking for a specific profile of a law student or international relations student or political science students. We're looking for anyone that will be looking for being an advocate of the SDGs, an advocate of the young leaders, an advocate of looking for a better future. And I was in your position myself. The thing is that I had to sacrifice a lot of things, including my GPA, including free time, including vacations, including many other things that it was highly criticized by my friends, but by people I believe they were my friends at that point. Because once I told them I have to, I said, man, I have to talk with the professor because I cannot take this examination because that day I have to travel to New York to a conference of CSW for 1 whole week. And they said, but why you're doing that? You're at med school. I mean, why are you doing this? So I took the exam the same day I was leaving. I had to prepare the whole week previously for the CSW and for the examination. I had my brain divided in two. And for anyone that has been struggling trying to concentrate, trying to do two things at the same time, well, you can imagine the result of my examination at that moment. But those are the main sacrifices I had to make. Now that I'm a medical intern, I was really scared of what hospital I was going to get into it, if I will have the possibility to choose it, or due to my GPA, the university would choose it for me, or what would happen with me. I didn't knew what was going to happen. But at the end, the results of the sacrifice you make during med school regarding for taking an app or following your other dreams and following your passion, they are worth it. Believe me, they are worth it. And you're free to join UNESCO Center for Peace anytime you want. You just have to contact me.
Thanks. Very, very, very inspiring.
I'd actually love to jump right in once again because like hearing you two speak, like I can feel like I can feel like I'm hearing myself speaking, you know, because I so identify to both of your experiences, you know, especially I mean for those who don't know me, like well those who do know me would know that actually when I was debating whether to go into medical school, I was actually about to choose international relations, you know, because I was very interested in public health, diplomacy. I was very multilingual. My family's all very international as well. Everybody expected me to go into international relations. And I remember the moment I told my entire high school class that I was doing medicine. Like I could see jaws dropping. Like nobody could have predicted that. And I don't get me wrong, I love medicine, you know, and everything. And I love surgery as well. But I think what you guys have been talking about is key, which is like I think passion, right? And for me, um, diplomacy, policy, advocacy, like that's where my passion has been for quite some time, you know. And so getting involved in like all these different things that people don't really understand because yes, you are a medical student. Like, why the hell would you go to a conference that will probably not benefit you in like clinically, right, for your career, or in terms of or academically in terms of research, right? And I've also been told that. So yeah, but I think like what has really pushed me and made in making those decisions and choosing to make those sacrifices is definitely that passion, right? Because like Santiago, I can tell like you are so passionate about that. Like there is no question, right? And I love seeing that, right? And it's inspiring, absolutely. And I think like all these organizations, there's so many youth spaces. Like even the WHO has like the Youth Council, UNESCO has like a section for youth, you know, and like so these organizations want youth, like they want our perspective because it's actually valuable, you know, and people are starting to realize that now. Some like clinicians old school maybe not so much, but yeah, you know, it is what it is. But I think like also Surmai was mentioning this on on not knowing about all of these activities, you know, how she had to like set out to learn about, you know, how to set up a national working group, or like how to do all these things yourself, because sometimes you don't have like the information out there or the support network or any of that. And like that's been my case as well. But I actually wanted to ask Sunmai, um and right before handing it over to Surmai, I'll let Santiago answer. But I wanted to know, like, have you found, you know, having to kind of just like set out to learn, right? It is a very big opportunity to learn. And I've always told even my own mentees, because now apparently I have mentees, right? That you just DIY everything, fake it till you make it, you know, just do it confidently, and just like learn it on your own, right? But how much of a setback has that been for you, right? Because like sometimes you can, when there isn't the information available, you know, to learn about it, and you don't have a mentor and you're really lost, but you really want to get involved. Um, to what extent has that been a setback for you?
Did you want Rico to answer your question? Santiago first?
Yeah, Santiago, did you want to like jump in right before? Sorry. Sorry.
I would prefer to Mike to answer this question. I just wanted to make a small intervention regarding hearing about every one of you that each one of you is also passionate for these international cooperation activities, Model of the United Nations, United Nations activities. I would like to open the offer, the possibility to make a partnership between UNESCO Center for Peace and Incision to create a pathway for all these medical students in order to connect again or for the first time with United Nations World, with UNESCO Center for Peace, and create another possibility for all those people that they gave up their dreams in order to pursue another dream in a medical career to join us again, and we'll be more than pleased to help and to work together with Incision in order to achieve this. That's the last intervention I was going to make. Sir Mike, you have the word for answering this.
Thank you. Yeah, so I think like that's a very good question, Angela. I would definitely like being quite honest, how much of a setback this has been, because it takes time for us to learn things from scratch, right? Like if to begin with, like if we are trying to find out the ways to do certain things, or to get into certain groups, certain societies, it takes time to figure out like how to achieve that. So the biggest setback is that you might fall behind a lot of your peers who have mentors, who have the guide, whose school sponsor things, the schools that are very active in basically organizing events or having their own clubs. Because like in this space where we are speaking with people from different geographical area, a lot of us come from public funded universities. These universities don't necessarily have the resources to like basically like guide each one of their students, or even the professors themselves have not taken a route that's involved in multiple projects or multiple spaces, even in research niches specifically. So forget about just research guidance. Like if you want to pursue something on the side that involves your advocacy in public policy, we have nobody to guide us. So it's the time that's more valuable that we spend in learning things and knowing things. So definitely it makes the start point different for everyone, especially in these two cohorts, when one person is from a university or a program that is highly engaged in these sorts of activities, who have peer groups, who have mentor-mentee groups, who take mentorship seriously. Because that's another agenda, that not every university across the globe take the role of mentor-mentee relationship that seriously. So people don't realize in a lot of countries that their 2 words of motivation or guidance to an MS1 or MS2 can literally change their whole path towards residency or subspecialization, or their involvement via MPH in whatever sub niche you want to pursue MPH in. If you want to go in WHO, UNESCO, UN Health, there's so many opportunities out there. So that's definitely the cost of not knowing things beforehand, because now that I'm in the space, I'm trying to like know more things. I realize that the students from, like, let's say my batch, who had these resources, like how long before they have known things, like am I being left behind? I try not to, like all other people who learn things on their own, but it definitely plays a role in your timeline. But that being said, it should not discourage you from pursuing things thinking that, oh, I'm too late. You're never late. You'll meet a lot of faculties who have never done these things, even in the US or in the UK, Canada. and you can always start. Also, because at the moment you might be thinking that someone else is ahead of me in knowing things or in pursuing things. It does not really work like that. Like 4 years ago, if I could go back and give myself the advice, I would try to like tell myself, don't worry, you'll be there, like you'll know things as well. And like everyone has their own timeline with because some people who are at the moment might be interested in certain types of research. They might not be in a few years. And I've seen such peers. I've seen some seniors who are like that. Like I would say like 2 years ago, they were very active in certain niche of research, but now they are not. So it's a cycle. People shift. It works that way. And I always think that whenever I think of my own setbacks, I always think of like paying it forward, and for which I'd like to, like, if anyone here is interested in for example, like certain international collaborative research, etc. Along with some residents here in the States, we are making a mentee club. So we welcome anybody who wants to reach out and seek guidance and to learn things, because a lot of times, if you know the directions, what you have to do, you can at least start. But even to like know what are the steps, it just takes a little bit of time. So like if we could pay it forward to our mentees and save their time in learning things, they would feel like that we have done something in the space. Does that answer your question?
I think like that's an excellent point that you make, the role of mentorship in all of this. And I've also like noticed, like as you were talking, you know, I've come to a realization that you're absolutely right. Like mentorship programs aren't necessarily like all great as they're advertised, right? Because like a true mentor-mentee relationship, you know, is, as Santiago said, like that one person that supports you to the end, you know. And nowadays, like, yeah, like I've seen on social media, it's like, oh, we're launching a mentorship program. It's very difficult to set one up actually, because I mean, I've joined some of them just to test them out and see what it's like. And it seems so forced, you know, because like you get matched and I'm like, how does it, you know, how does that guarantee that you're actually going to get along with that person, you know, because it's more than just like a professional transaction or anything. It's like a friendship to an extent. So yeah, and I definitely love like your point on like paying it forward. You know, that's always been my motto. You know, I mean, like in my experience is I haven't really had people to pay it forward for me. Sometimes it's competition, right, which is like another topic you could get into, right? That like competitiveness is like gotten a bit like out of control in some situations, right? But I think like maybe we as leaders as well, right, we can especially youth leaders, right? We can take on the challenge of actually breaking that cycle. And so if we're the first to, you know, be those to pay it forward, you know, maybe we can create a culture where that's more the norm as opposed to, you know, like competition on steroids.
Right. No, I actually like definitely agree with the correlation of competitiveness that goes into, because this is a Venn diagram. Like mentorship relationship exists, but then there is a play of competitiveness. Because like if you are working or if you are being a peer mentor, for example, a lot of times there could be like a little bit of glitch that's related to like safety of the ideas. Like people don't want to share their ideas thinking that it could be stolen. And I'm not gonna like lie, these things happen, which is why like there has to be, like, I don't know, like there would be a dream world, like if we could create a space like that, that everything is secure, like people can say their ideas, they can share their ideas without having the hesitancy that someone else is going to take over who has more knowledge about the field. But this thing definitely exists. Like there is a significant role of this little thing we call like competitiveness that goes into these spaces of mentor-mentee relationships as well. Because as we try to like develop things, we realize that there are very less number of senior physicians who are willing to hold hands of some 25-year-old person. So we end up coming down to fellows, then residents, and then you have like senior medical students guiding the junior ones. So I feel like if like we can make it a standard that if your mentee is sharing something with you, an idea, you try to promote them, you try to support them with what they need, guidance, etc., like as long as they're willing to work. So these things definitely exist. But yeah, like you said, like paying it forward is definitely very necessary. And that's the whole idea about having these sorts of clubs.
Perfect. It's very wonderful.
Thanks.
I have a question for Dr. Muhammad, if it's okay. I wanted to know, how did you manage to navigate the emotional toll working in high stress situations like during COVID time?
Okay, thank you, Miriam, for the very a good questions regarding my experience for the COVID-19 situation. I was like making a peer group, like uh having a Zoom call like every week with my fellow friends at my faculty, because we have been like working at different areas, different hospital, because due to limitation of a medical doctor during the COVID situations. And we are sharing about our mental health, about working experience, and we also share about how to manage this to decrease the stressful. So basically, after the after the pandemic, we decide to have like a short vacation because our government give like a voucher. I don't know. Yeah, I mean like a voucher to all of medical doctor after the pandemic. They have they can go to like if you know, Indonesia have a Bali or something like island things. So to have like less stressful after working like chaotic in emergency department. And during the during the COVID also, we have been like routinely communicate with our supervisor and our professor, due to the limitation of some like medical tools and some of the medicine and etc., how to handle it, how to find another solutions to treat a patient but still in manage. So that's the my experience. But we know that COVID was very, very unexpected experience. And I guess that having a good communication and having like routinely routinely speak with my fellows and my friends regarding our experience is a good time to it's a good way to share, because if we keep that our experience only with ourselves, it will make mine it's burnout and like stressful. So venting out it's important due to the COVID situations. And some of my friends also having like consultation with psychiatrists and psychologists, because of like, can you imagine that we have been graduate but we didn't like prepare for the pandemic. So that's the support team and support environment is really important for that situation. And the impact from now is we have more for Indonesian. We are aware with the mental health issues, because before COVID, the mental health is like have a lot of stigma for our countries. So after COVID, that our government aware, because the number of psychiatrists in Indonesia is very low, and people aware with the mental health issue is very low. But after that, now a lot of movement by youth to spread out the importance of the mental health, especially in workforce. It's more spread out by the generation after COVID-19. And especially if I want to share that in Indonesia, residence is not paid, that we need to pay as a resident. So it is still happening in our countries, but now our ministry after COVID-19, looking that the hospital base that the resident will get paid uh because they are work at the hospital, but before we didn't get paid yet. So that's the problem in our countries. But now we have like a movement from the youth and also a movement from our ministry to having revolutions because of our healthcare system is the only countries that for the residency program that didn't pay anymore. So if you didn't get, if you doesn't have like money, especially as a resident working during a COVID situation, it is very crazy. So I was working with a resident due to my internship, and they are more stressful because can you imagine that you need to pay, but the Ministry of Health in my country was given like pay due to the COVID, and after that they having a new policy, and yeah, a new policy that arranged that all of the resident will get paid. So we are thank you for pandemic that changes our healthcare system. After like 70 years, we didn't having a new revolution. So I think it's a good moral failure, a good situation after COVID that our healthcare system is changed. But the problem is we are still limit on the hospital referral, and our country have also limited on the some medical devices. So that's my country situation because we are the middle income countries, and also related that the research that we have that I heard from this panel, this discussion, we are aware about the research. We are want to have a research, but the limitation is the tools. So I am also working as a researcher. We are always having a collaboration with the other countries to having a clinical trials. We import everything. So I think that's the faces is problem in lower middle income countries. We doesn't have like a good resources for doing practice and also having research. So I think collaborations across of regional countries or difference like from the uh, like countries from Europe or Americas is a good way for us in Indonesia to increase more about the research about practical in medicine, because as if you know that in my hospital is a regional hospital in city referral, it's we only have like 20 ventilator, if you know. So can you imagine if the all of the patient coming to my hospital and we doesn't have like ventilator for a patient? So that was also make me burn out as a general practitioner, as a doctor. But sometimes there is like an art as a doctor that how to communicate the patient, how to manage it. That yeah, it's hard for us as we have faces that limited resources and devices. So that's the condition. Maybe it's different with other countries from especially in the north side, because that's the situation in Indonesia, because Indonesia is a very big countries. And also we doesn't have a good um doesn't have like more specialists due to that the situation that the resident is not paid. So that's the faces the struggling my country, why my country is still need more collaborations to improve our healthcare system. Thank you.
Thank you for your answer. Actually, I can relate to a lot of things you said. Since I'm from Morocco, by the way, and in Morocco, we have been dealing with a lot from the healthcare system. We also have had some struggles. We're actually, most of our medical students are on a 1 year long strike right now. So it's still ongoing, and this is why this topic is very important to me, resilience and how to be able to face burnout. Because most of the people, the medical students I talk to right now, all of them are talking about mental health issues like depression, anxiety, not being able to go back to studying. Like they're really struggling with that and finding like motivation to keep going. So that really means a lot, as well as the fact that you mentioned that mental health is actually stigmatized in Indonesia. It's actually the case in Morocco, but after COVID-19, it actually became way better. Like people have recognized depression from being confined in their homes. So I guess there are some positive things that came out of it. So I hope that everything gets sorted out for you as well. Thank you for your answer.
I'd just like to add, like, it's so true that, you know, one thing that probably all of us have in common is COVID, right? Because it was just so huge, right? And for sure, like I think on a personal level, it has affected a lot of us, But I think as well on top of that, on top of like the stress of, not being able to go to work or being confined or whatever, right? I think for healthcare workers, right? And this includes like medical students or residents, it affected even the working conditions, right? Because your job is, like being at the hospital, saving patients' lives and all that stuff, right? And when you don't have the resources to do that, like in a pandemic where you have way too much demand and not enough supplies, it and then you add like an extra layer of frustration. It's like I can't even do my job right in these conditions. Like, what the hell is the government thinking, right? And then, and that adds to the anxiety, And I don't even want to imagine, right? Because I'm currently in Switzerland, so I am in a high income country, right? But I can't even imagine what this is like for middle and low middle income countries, where the 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 supply the supplies medical supplies side of things is even more relevant, right? So I can't even imagine, um but yeah, like I think um I guess we're lucky in the sense of mental health has been brought very much to the center, and hopefully like we actually, because I generally don't think it's made up, right? Because sometimes people say that the mental health is the same as it always was. It's just that now we have more awareness. Like I think that's a component of it, but definitely agree that like the we are living in a stressful world right now, and I think most people can agree on that. And so it's normal. It really is normal to be stressed about this. So yeah, I think that's about it for me. Thanks.
I think it has been a really amazing discussion. Even though we have like questions prepared, like it has been such like a fruitful discussion. I don't know, Angela, do you know when this event is supposed to end?
In theory, it was scheduled to be an hour and a half, starting from 6:30 GMT. So in theory, in about 5 minutes.
Yeah, so
Nä iwerfigma Irish na with like in Eroksta, in Emerine at the thought now in at least such an akula ma na she is her machine and yours, but as Nick Yawas in Emerson and Emerfa, the other one that then I could math how you put Irish on that night ma na shaxi earth no, but I can live in exact ma on I but off the accident I can now we was a shock ma see that all the
I think like I'd like to get like more involved with Incision, but I think like every one of us is so busy, so I'd take this opportunity to just like mention like a few things. Because like I've been trying to like send messages to maybe like the chair when needed. Um, Over here, like here in the States, we have a pretty much established group of people who are willing to support the medical students. So if anyone has mentees looking for guidance, I'm like happy to connect them with my peers who want to collaborate, who want to guide. Um, and for some reason, like we don't have any some specialty, because a lot of time people ask what specialty they are in. I just want to say that a lot of guidance that goes into the process can be generalized over specialty. So that you don't have to be an internal medicine to guide the internal medicine aspirant. So if any one of you is looking for connections for your mentees or yourself, like please feel free to reach out. Um, I'm also with the IT team, or I can send my email address. So if I have anyone who's looking for mentees, I can definitely go ahead and connect you guys. That would be it from my end. But it was great conversation. Thank you for organizing this event.
Thanks for offering to connect mentees. I'm sure there would be a lot of I'm sure it's like a very good opportunity to get involved. So thank you for offering for that. And I think we're now 2 minutes remaining. If no one else have anything else they would like to add, then I think we can end this panel. And Dr. Shakla, okay, you send the email in the chat. So anyone in the audience or on the team who's interested, Dr. Shakla has kindly shared her email with us. So if you're interested in becoming a mentee to collaborate, then that's her contact information there. And I just wanted to thank everyone, all the panelists for sharing your story with us today, and all the audience to come and join in on this important and insightful discussion that we had. And yeah, without anything else, I'll just wrap up this panel here. Thank you again for coming.